Hello, and welcome to this online offering of SBAR reporting and bedside handoff for clinical staff. My name is Mike Finch. I'm a registered nurse in hospital education, and I'll be your narrator today. Let's begin with the objectives. At the completion of this module, participants will be able to do the following: understand the medical center policy concerning SBAR communication, define each part of SBAR and what it means, understand the benefits of using SBAR for communication, know when SBAR needs to be used for communication, define what bedside report is, and understand the benefits of bedside reporting. Medical Center Policy, MCP 6019.509, Handoff Communication, SBAR. This policy establishes that SBAR is the process that will be utilized to receive or share patient information related to treatment and services for both internal and external providers. Please make sure to read this policy, know it, and understand it. If you have any questions, reach out to your nurse manager or supervisor for clarification. Situation. The S component should take about 8 to 12 seconds. The nurse states what's happening now. If giving shift report to the next caregiver, the nurse states the patient's name, why the patient is on the unit, and introduces the nurse coming on duty to the patient. For example, Miss J, this is Tina Jones, the registered nurse who will be caring for you today. Tina, Miss J is here to have rehab after her right knee replacement. To be effective, you must be concise, clear, and to the point when giving the report, leaving irrelevant information out of the conversation. Background. During the B component, the nurse gives the next caregiver brief background information specific to the patient's relevant history. This section sets the context for what's being discussed, which may include the patient's diagnosis, history of procedures done, and family situation. For example, Ms. J had a right knee replacement on June 3rd by Dr. Smith. She has a history of hypertension, diabetes, and arthritis. She lives with her husband, who's retired and able to care for her at home when discharged. Assessment. During the A component, the nurse reports the current condition of the patient. For example, blood glucose levels have been stable, vital signs within normal limits, and the incision line is clean and dry with no drainage noted. The dressing was changed today. Ms. J is able to ambulate to the restroom with a contact guard of 1 and use of a walker. Her pain has been reported as a 7 on a 0 to 10 scale, and she was given 2 hydrocodone pills at 9 a.m. The hydrocodone appears to be helping her, especially when given before therapy. Recommendations. During the R component, the nurse identifies the patient's immediate needs and explains what needs to be done and when. You may suggest that discharge planning be initiated by discussing needs with the patient, contacting the physician with discharge plans, and conveying to the rest of the care team what needs to be done before discharge. For example, Ms. J is scheduled for discharge this Friday and will need to speak to the discharge planner today. And remember, not everything about the patient needs to be conveyed in this section, just what's pertinent to the situation at that time. And effective communication takes 2. Ask if there's any questions, and remind team members and the patient that you'll be available should further clarification be needed. Facility SBAR templates. There are 3 approved SBAR templates for use at Charlie Norwood VA MC. These tools provide a way to document necessary information in an easy-to-use format. The templates are organized by the area they are used. There's a mental health and DOM SBAR template, a CLC and rehab SBAR template, and an acute and SCI SBAR template. Please remember that this tool is not part of the patient's permanent record and will be disposed of upon discharge. Emergent SBAR example. The SBAR format can also be used in more emergent situations such as this. Dr. Smith, this is Mike RN and I'm calling from MedSurg about your patient Jane Doe. Situation. Jane is having increased dyspnea and is complaining of chest pain. Background. She had a total knee replacement 2 days ago. About 15 minutes ago, she began complaining of chest pain. Her pulse is 120 and her blood pressure is 128/54. She is restless and short of breath. Assessment. I believe she may be having a cardiac event or a pulmonary embolism. Recommendation. I recommend that you see her immediately and that we start her on O2 stat. Do you agree? Benefits of using SBAR. It provides a clear, concise, standardized format for all reports or handoffs. It's a format that is recognized and accepted across the caregiver spectrum, and it allows transfer of critical information rapidly. When does SBAR need to be used? Per medical center policy, SBAR must be used for the following: end of shift reports or shift changes, anytime clinical staff provide coverage for other team members for a short time, such as, but not limited to, breaks, meals, class, or committee meetings. Note: an abbreviated handoff that addresses changes to the SBAR report will be provided to staff accepting care of the patient and upon return of the initial staff member. When relinquishing and assuming patient care responsibility, and when admitting a patient to any patient care area. When does SBAR need to be used? Continuing. When transferring in or out of any clinic, unit, or department within Charlie Norwood VA/AMC, a patient who has received nursing, procedural, or clinical care. Transfer of patients following any procedure or operation, inter-facility transfers, ambulance transfers, and transfers to outside hospitals, skilled nursing facilities, or other long-term personal care facilities. What is bedside reporting? Bedside reporting is the change of shift report between the off-going nurse and the oncoming nurse that takes place at the bedside. The patient can identify family members or close friends to participate. How is bedside reporting beneficial to our patients? Listening to report, the patient learns about the plan of care and the goal for the day. It acknowledges the patient and provides a feeling of inclusion with the nurses as part of the healthcare team while providing reassurance to the patient that the nurses work as a team. It reinforces that nursing staff is getting the information needed to facilitate care and decreases the patient or family anxiety and improves patient satisfaction. And it gives the patient and family opportunity to ask questions or correct information. You'll also want to make sure that you discuss bedside reporting process with the patient upon admission to the unit. The patient can choose whether family or significant other can be present during the bedside report, and those wishes must be passed from nurse to nurse during report. How is bedside reporting beneficial to staff? It allows you to put eyes on your patient during shift change. It gives you the ability to check fluids, medications, tubing expiration, and overall cleanliness of the room before the off-going RN leaves. It provides an efficient report which streamlines all pertinent information and saves nursing time. It improves staff's teamwork by giving nurses the opportunity to work together at the bedside, ensuring accountability. Using a standardized format reduces the risk of miscommunication because it overcomes different communication styles. And nurses are always on the same page during the report because they're both looking at the same information at the same time. Wrap up. The utilization of both SBAR and bedside reporting not only increases safety, but also patient and family satisfaction. It assists staff by having a single reporting format so important information is shared, and it allows the patient and family to take an active part in their care. Questions, comments, concerns? This slide has my contact information if you have any questions about this PowerPoint presentation. Again, my name is Michael T. Finch, MSN RNCNL, and my email is michael.finch3@va.gov. If you have questions about SBAR or bedside reporting, please reach out to your nurse manager or supervisor. Thank you.